Hello everyone. This is Dr. Deepak Kumar. In this video, I'll be presenting to you an interesting scenario, after which I will ask you to identify what may be the cause for the damage of the kidneys. Okay, and so let's begin. This is the scenario. Imagine a patient is admitted in the hospital with severe abdominal pain, and on history, you identify that patient is diabetic and he is on medications for 10 years. Considering the patient had severe abdominal pain, you suspect an infection and start antibiotics. And one of the antibiotic is an aminoglycoside. Before you giving him the aminoglycoside, you are looking at all the parameters, body weight, and you are dosing him appropriately. At the same time, there is a suggestion that you have to get the patient um, done with an imaging called contrast enhanced imaging of the abdomen to identify if there is any cause. And you take the necessary precautions, follow the protocols, fix an appointment with the radiologist, and you get the contrast enhanced computed tomography of the abdomen done. Now, when you are following up with this patient, you get to see that when the patient who was admitted, the initial reports suggested there was no kidney damage. However, on the second day, the report shows there is damage to the kidneys. Now, what do you think caused the damage to the kidneys? Was it the aminoglycoside, which is known to cause nephrotoxicity, or was it the contrast enhanced CECP of the abdomen with iodinated contrast that was used that caused the damage? How do you tell? Also, you notice that the patient had a decreased urine output since evening on the same day. So this is the scenario. What do you think caused the damage? Was it aminoglycoside or the iodinated contrast resulting in contrast-induced nephropathy? 5 seconds for you to answer. Okay, good. So in this case, the answer is the renal damage happened because of contrast-induced nephropathy. The reason being, in contrast-induced nephropathy, the damage starts within 1 or 2 days, peaks between 3 to 5 days, and usually resolves within a week. In a patient who has aminoglycoside toxicity, the renal damage happens after 5 to 7 days of starting the antibiotics. Sometimes even you would have already stopped the antibiotic before the damage even starts. For example, you would have used aminoglycoside for 5 days and the renal damage starts to appear after day 5. That is, patient would have already used up the full, maybe might have completed the course of aminoglycoside antibiotic, and despite that, he may develop a renal damage. In the given scenario, since the patient developed the renal damage within 2 days, you can safely assume that the damage was caused by contrast. Also, one more evidence was the decreased urine output, which suggests contrast-induced nephropathy, because in aminoglycoside-induced toxicity, the nephropathy is of non-oliguric acute kidney injury. That is, patients will have more than 400 ml of urine output per day. Well, I hope this evidence will help you identify patients in future who may present you with renal damage, and you will be able to tell whether it was because of the contrast or aminoglycoside. See you soon with another interesting video. Bye.